Good afternoon, class. Today, we are going to continue discussing about developing a health education plan, part 2. After an excellent learning experience, someone might comment, "Now there is a born teacher." This statement would seem to indicate that effective teaching comes naturally. Actually, being able to teach well is a learned skill. There is no one perfect method for teaching all learners in all settings. Also, no one method is necessarily more effective for changing behavior in any of the three learning domains. But, as the saying goes, that we all learn more when we do things. So whatever the method chosen, people learn best when it is used in conjunction with another method or with one or more of the instructional materials available to accompany the teaching approach. All right, so let's proceed to the next slide. Class, this week we will focus on traditional teaching strategies and activity-based learning. These are our learning objectives. First is to define the term teaching method, explain the various types of teaching methods, describe how to use each method effectively, identify the advantages and limitations of each method, recognize techniques to enhance teaching effectiveness, and explain how to evaluate teaching methods, which you'll be doing in your assignment. So, my first question for you, class, is what is a teaching method? What do you think? So, a teaching method is the way information is taught that brings the learner into contact with what is to be learned. Examples of such methods include lecture, group discussion, one-to-one instruction, demonstration, and return demonstration, gaming, simulation, role play, role modeling, and self-instruction modules. As the use of technology evolves, these teaching methods also are being offered as blended opportunities by integrating online and hybrid learning strategies, which we are currently using today. So deciding which methods to select must be based on a consideration of such major factors as the following. First, audience characteristics such as the size, diversity of learners, and their learning style preferences. The educator's expertise as a teacher. Objectives of learning. Potential for achieving learning outcomes. The cost effectiveness of the teaching method. The setting for teaching. And evolving technology. So, what are our traditional learning strategies? We have the lecture, discussion, and the use of audiovisuals. Let's discuss each of them. First off is lecture. I think you have already encountered this during your younger years in learning. Now, by definition, lecture can be defined as a highly structured method by which the educator verbally transmits information directly to a group of learners for the purpose of instruction. It is one of the oldest and most often used approaches to teaching. The word lecture comes from the medieval Latin term legere, which means to read. Now, lecture can be useful in describing patterns, highlighting main ideas, and presenting unique ways of viewing information, such as introducing an agency's mission statement to new nursing staff orientees or explaining diabetes mellitus to a group of patients. Now, the lecture method has been highly criticized in recent years because, in its purest form, the lecture format allows for only minimal exchange between the educator and the learner. Also, critics of the lecture method have specifically expressed concern about the passive role of learners. What do you think, class? Do you think this is the most effective way for you to learn? Well, it's all up to you. Let's go to the next slide. Group discussion or discussion. In general, the benefits of group discussions are that they lead to deeper understanding and longer retention of information, increased social support, greater transfer of learning from one situation to another, more positive interpersonal relationships, more favorable attitudes toward learning, and more active learner participation. As a commonly used instructional technique, this method is learner-centered as well as subject-centered. Group discussion is an effective method for teaching in both the affective and cognitive domains. Let's talk about the last traditional teaching method, which is using audiovisuals. Using audiovisual materials such as a video, a podcast, PowerPoint slides such as this one can also add variety to a live lecture. The widespread availability of technology makes it easy to enhance the presentation, but only if the technology is used wisely. Now, when developing PowerPoint slides, for example, like this one, we educators should adhere to the following general guidelines. First, do not put all content on the slides, but include only the key concepts to supplement the presentation. Use the largest font possible, although for this one, we usually apply this for live lectures wherein we need to use a projector for the slides. Next, do not exceed 25 words per slide. Choose colors that provide a high level of contrast between the background and text if presenting in a large room with bright lights. Use graphics like figures and tables to summarize important points, to succinctly present information, or to share large amounts of numerical data. Finally, do not overdo the use of animation, moving figures like PNG, which can be very distracting to you, the audience. Overall, it is important to keep the following points in mind. Make sure that the visual aids are large enough and positioned well enough for all to see during a live face-to-face lecture, and keep them simple and easy to understand. All right? Okay, so that's the last of the traditional learning methods or teaching methods. Let's go to the next. Let's discuss about activity-based learning. We have the cooperative learning, demonstration and return demonstration. I added this one. Concept mapping, debates, simulations, and problem-based learning. Also, an added one, which is the self-learning modules, which has been largely adapted during the pandemic learning method. Let's discuss each of them, shall we? Let's go. Now, cooperative learning is the methodology of choice for transmitting foundational knowledge. Additionally, cooperative learning is distinguished by the educator's role, so in which the educator is the center of authority in the class, with group tasks usually more close-ended and often having specific answers. Now, cooperative learning includes 4 key components, which I have already shown to you here. First is extensive structuring of the learning tasks by the teacher. Next, strongly interactive student-to-student execution of the tasks. Third, immediate debriefing or other assessments to provide the teacher and students with prompt feedback about the success of the intended learning. Lastly, instructional modifications by the teacher based on the feedback. Do you think you have already experienced cooperative learning? Okay, let's go to the next one. Demonstration and return demonstration. I added this information here for our discussion since this is commonly done in the education of nursing. Now, it is important to begin the discussion by making a clear distinction between demonstration and return demonstration. So class, what do you think is demonstration? I'll give you a few seconds to think about it. So demonstration by the educator is done to show you, the learner, how to perform a certain skill. Prior to giving a demonstration, we educators or clinical instructors should perform or should inform you, learners, of the purpose of the procedure, the sequential steps involved using your PRS, the equipment needed, and the actions expected of you. It is important to stress why the demonstration is important or useful to you. Usually our demonstrations are the procedures that are commonly done in the clinical setting. Now, equipment should be tested prior to the demonstration to ensure that it is complete and in good working order. For the demonstration method to be effectively done, you learners must be able to clearly see and hear the steps being taught. Luckily for you, class, we already have the recorded video procedures for you to follow so that you'll be able to review them at your own convenient time. Now let's go to the next question, which is, what is return demonstration? I'll let you think about it for a few seconds. You may have heard about this from your upperclassmen, right? Or have you already done this already? What were the previous return demonstrations you've already done? I see. So return demonstration by the learner, or you, is carried out as an attempt to establish competence by performing a task with cues from the educator as needed. These two methods require different abilities of both the educator and the learner. They are especially effective in teaching psychomotor domain skills. Return demonstration should be planned to occur as close as possible to when the demonstration was given. Learners may need reassurance to reduce their anxiety prior to beginning the performance because they may view the opportunity for return demonstration as a test. Well, honestly, such a perception may lead you learners to believe that you're expected to carry out a perfect performance the first time. As always, whenever I host or facilitate return demonstrations, I always inform or tell my students that it is okay to commit a few mistakes during your return demonstration since this is just a form of practice. So relax. So once a learner recognizes that the educator is a coach and not an evaluator, the climate will be less tense and the learner will be more comfortable in attempting to practice a new skill. Educators can stress the fact that the initial performance is not expected to be perfect. Of course not. It's the initial performance, right? So in addition, allowing the learner to manipulate the equipment before being expected to use it may help to reduce anxiety levels. It is important to note that when the learner is giving a turn demonstration, we educators should remain silent, except for offering cues when necessary, especially when you forgot a line, or briefly answering questions. Learners may be prompted by a series of pictures or coached by a partner with a checklist, but usually you have to do it alone. Do you think you're ready for the next return demonstrations? We'll see. Let's talk about concept mapping. Concept mapping is a skill that you will usually do in your second to fourth year level in college. Now, what's concept mapping? Is it like the Marauders map here? Hmm. Well, concept mapping enables the learner to integrate previous learning with newly acquired knowledge through diagrammatic mapping. As a motivational technique, concept mapping facilitates the acquisition of complex, new knowledge through visual links that acknowledge previous learning. Learner interest is sustained by perceived competence and autonomy. Concept mapping, as a less instructor-regulated learner activity, promotes interest and value on behalf of the learner. Hopefully, you'll learn how to do proper concept mapping in the next semester. Good luck. Let's go to the next slide. Let's talk about debates. Do you think Malfoy and Harry are going to have a debate here with their wands? Seems unlikely, right? Debates as a teaching tool can be traced back to ancient Greece, with the sophists, Protagoras, and Aristotle as the earliest pioneers. Today, debates exist in countless forms in any society, ranging from government debates, such as what's happening right now for the elections, court proceedings, to debates in media and everyday life, where individuals present opposing views through social interaction, such as you and your mom. Well, as an instructional method, debating involves students in expressing their opinions from two competing perspectives with the goal of contradicting each other's arguments. An opportunity for decision may be given after opposing views are presented in alternating statements. Now, much as the format can vary, a classroom debate that serves effective teaching and learning is encouraged to incorporate four conceptual components. First, development of ideas with description, explanation, and demonstration. Next, clash of opinions supported by reasons and evidence. Next, extension or arguments against criticisms which again rather are refuted by the opponent. And finally, perspective, the process of weighing ideas and issues to conclude with a logical decision is made, either about the issue or about the presentation of arguments. So, would you like to have a debate with these wizards? Sounds interesting. Let's go to the next discussion. Simulation. Are you afraid of your own boggart? Well, simulation is a trial and error method of teaching whereby an artificial experience is created that engages you in an activity that reflects real-life conditions, but without the risk-taking consequences of an actual situation, such as this one, when the wizards or student wizards were trying to face their own fears through the boggarts. Simulation is a highly innovative teaching method to teach health professionals about the complex world of teaching healthcare in their respective disciplines in an effective, efficient, safe, and high-quality fashion. As GABA explains, simulation is a technique, not a technology, to replace or amplify real experiences with guided experiences that replicate substantial aspects of the real world in a fully interactive manner. Well, do you think you can interact with your own fear? I hope you'll be brave. Let's continue. There are many types of simulations, which are the following. Written simulations, which may use case studies about real or fictitious situations with the learner being asked to respond to these scenarios, which are common right now in the Level 3 and Level 2 experiences or teaching learning methods. Staff nurses, for example, might be asked to describe how they would handle a personal communication problem on a unit or manage a physiologically complex patient in the critical care environment. Clinical simulations can be set up to replicate a complex care situation, such as a mock cardiac arrest. These are usually done in our nursing skills lab and in our nursing arts laboratory in our Faber Hall. An experienced nurse can serve as a buddy or a coach for the inexperienced nurse who is running the code. We also have model simulations, which are frequently used to teach a variety of audiences. We are usually doing this as well. An effective and economical method to teach certain non-invasive skills is to ask a peer, educator, or trained individual to act as a patient. Now, an innovative technology is a high-fidelity whole-body patient simulator, such as SimMan, that reproduce in a sophisticated, lifelike manner the cardiovascular, respiratory, urinary, and neurological systems. Right now, in our own nursing skills lab, we have a low-fidelity type of model, but we are still learning a lot from these models. Finally, we have the computer simulations, which are used in learning laboratories to mimic situations whereby information and feedback are given to learners in helping them develop decision-making skills. We are also using this using our virtual classrooms in eLearn. So, what other simulations have you already experienced? Can you think of one or two? Have you made your own boggart already? Hopefully not. Let's discuss problem-based learning. What do you think Hermione is thinking about? A new skill in wizardry? Or new potions to make? So, problem-based learning is a student-centered approach in which students learn about a subject by working in groups to solve an open-ended problem. This problem is what drives the motivation and the learning. A well-designed PBL project provides students with the opportunity to develop skills related to the following: working in teams, managing projects and holding leadership roles, oral and written communication, self-awareness and evaluation of group processes, working independently, critical thinking and analysis, explaining concepts, self-directed learning, applying course content to real-world examples, researching and information literacy, problem solving across disciplines. Let's discuss about the self-learning modules. Now, this is a method which is an individualized way of learning. The face-to-face teaching is already disappearing nowadays, and distance mode of education is becoming popular. Self-learning modules are designed where the learner is free to choose what to learn, how to learn, when to learn, and where to learn. This flexibility is an important characteristic in open learning process. With the advent of information technology for communication, the other modes of instructions are slowly disappearing. The learner is getting accustomed to more and more non-formal mode of education, thereby shifting the preference to self-learning methods. Do you think you prefer self-learning modules more than face-to-face classes? Or do you prefer a blended style of learning? I see. All right. Now, class, now that you've learned about the different teaching learning strategies, which do you think do you prefer the most? Which do you think is the most effective way of learning? And which do you think is the least effective one? If you were to become a teacher someday, which of these teaching strategies do you think would be your most preferred method of teaching? Do take note of those answers of yours so that during our discussion you'll be able to also process those answers. Finally, according to Albus Dumbledore, every great wizard in history has started out as nothing more than what we are right now, students. If they can do it, why not us? So, dear student nurses, continue your openness to learning so that one day you will be an Atenean registered nurse. Thank you for learning with me today, my dear students. To God be all the glory. If you have any questions, kindly type them down in the question portal in your virtual classrooms or ask them during your respective synchronous classes. This has been Ma'am Shai. Thank you so much for your time today. These are your references in the next slide. If you'd like to check out the references, here they are.